So you remember the debate between Joe Biden and Bernie Sanders, right? Where Joe Biden brought up the fact that Medicare for all wouldn't work here in the United States because it wasn't working in Italy. And of course, Bernie looked like gobsmacked, like he, got all shit on and whatever. And it was really shocking to me as well. So I just had to bring this up because it's bothered me ever since. So I wanted to talk about it because Joe has been so proven wrong. It's just not even funny. It's so pathetic. All right. But just as a reminder, let's take a look at the video. Okay.
With all due respect to Medicare for all, you have a single payer system in Italy. It doesn't work there. It has nothing to do with Medicare for all. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single payer system.
Well, the fact is that it is working in Italy. So wrong, Joe. Okay? And Bernie really disappointed me. I love Bernie, but he disappointed me, with the world. No, man, he should have been prepared for this. And he could have just body slammed Biden, but he didn't. Okay? But the facts are these. Let's take a look at them. Okay, now we're talking about Italy. Okay, right around the end of March was where it really peaked. Then it starts to decline April, May, June, July, and it declines, from that point onward. They were ravaged by it. It's true. Okay, but the fact that they had universal health care for everybody in place, okay, mitigated it much quicker and much sooner. Canada, again, starts out in February. Canada begins to increase, I'd say, around the end of March, continues through April, peaks in May, then it starts to decline through June and July. So we see the decline, all right? And they've done a pretty good job as well by socialized medicine. It's a good thing. Let's take a look at the United States. That's not too good. Okay. Starts out in March like everybody else. Increases in April. Okay. Steady. Moves along through May, June. There's a slight decrease. And then it spikes again around the middle to the end of June and increases in July and has been increasing ever since. Okay. So we're looking at 160,000 deaths so far. And the scary part is that they're projecting the possibility of 300,000 deaths by December. We're looking at 5 million cases. 5 million cases. So pretty scary, all right, to live in the United States of America. I know we all want to head for the border, right? So Joe Biden said, because he's such a good guy. He said that he would be willing to nationalize treatment on a temporary basis for people affected with the COVID virus, right? COVID-19, but only on a temporary basis for the duration of the outbreak. Anything not to implement Medicare for all. Remember this, all of you, because you're going to go vote for Joe, right? You have to vote for Joe. What choice do you have? And they call that democracy. What choice do you have? It's a gun to your head like this. Joe's friend, Whitey Bulger, put a gun to your head like this and say, vote for Joe. And that's what you got to do. Because who we're going to vote for? Madman Trump? No, we're going to vote for Dementia Joe. That's the way it's got to go. Right? Or just, pull out entirely and don't vote at all. That might send a signal to the DNC. This is the same working class Joe that put Social Security and Medicare on the table for cuts. Okay? And he's a Democrat. Look, the Democrats are not liberal. I don't know what, please, you're confused if you think that. All right? They're center right. The Republicans are batshit crazy right. But the Democrats are center right. There is no left party in the United States. AOC is correct. we've got this Harvard study that I need to mention. Okay, it's from the Harvard Gazette. The study finds that 45,000 deaths annually linked to a lack of health coverage in the United States. And I'm sure the numbers are much worse now due to COVID. Okay. Oh, let alone, and we've all heard this one before, but let alone the hundreds of thousands of people that have to go bankrupt due to medical expenses. Okay. So this is one cruel ass society. You know, America, the land of the free, the home of the brave, the greatest country in the world. Really? Oh, I don't think so. You know, it's insane. This place is insane. This is supposedly the richest country in the history of mankind. It certainly is the most powerful militarily because we pay for all that. What I want to know is that these 45,000 people dying every year, why isn't that a national emergency for Joey? He doesn't even talk about it. 45,000. All right. Divided by 3, carried it 4, carried it. Yeah. Oh, wow. You know what that is? That's like 15 times. 45,000 is 15 times the 3,000 people killed on 9/11. And for that, we went into endless wars. Okay. That cost you and me, the American taxpayer, trillions of dollars. That's what we did. But we can't have health care for our people. Yeah? Our sons and daughters and cousins and nephews, they can go to war, but their family members can't have health care. And you know what? Joe, what does he do all the time? He's telling me, this is America. Yeah, that's the problem, Joe. That's the problem. This is America. Yeah, no kidding. That's the problem, Joe. You know, he's the patriot, right? He loves America. If you loved America, Joe, the most patriotic thing you could do is Medicare for all. Okay. And he was, the vice president of the first black president. Now he's got the first female, African-American VP, under him, or they're running together apparently. Right. So he's not racist, Joe. Right. That's what he says. Joe, you're not racist? He says, no, he's not racist. Okay. Well, Medicare for all is the most anti-racist policy you could possibly implement. Why? Because our African-American brothers and sisters would benefit disproportionately from it. We'd all benefit, but they would benefit disproportionately. Yeah. People of color would benefit disproportionately. So they don't want that. They don't want that. The DNC is not your friend. Okay, so just get that out of your head, man. So, just for an example, here's Mrs. Krebs. Okay, now she was sick. She had to go get tested. She felt not well. She went to get tested. A hospital forgot to bill her for her coronavirus. In the end, they sent her a bill for $1,980. Now, in the countries with socialized medicine, Canada and Italy that we talked about, there's no charge for the testing. And testing makes sense. Okay? That's how we know how many people are ill out there. Like dopey Trump was always saying, we test a lot. That's how we know. That's why we find more cases. No, the cases are already there. Testing is just clarifying that. The cases already exist. Even if you don't test, they exist. People are walking around with the virus and giving it to other people. We need to know who has the virus. That's important. The US is the only Western nation where millions of people have lost their jobs, okay? And as a result, their health coverage due to the COVID crisis, all right? No one has lost their health coverage in countries like Italy and Canada. You understand that, right? Countries that have single payer healthcare systems, socialized medicine. Socialized? No. Oh my God. That's such a scary word, isn't it? Socialized? But it's good enough for our fire department, police department, and military. See, they all get to live in a socialist paradise, and we all live in a capitalist hell. See, that's how that shit goes. And this is the richest country in the world, like I said. Well, we should be able to afford some nice things, don't you think? I do. In this Newsweek article that I'm going to point to here, dated April 24, 2020, it says that 88% of Democrats, 68% of independents, 46% of Republicans, that's 69% of Americans overall. That's 70% of Americans want something and they can't get it. Why not? Oh, because your Congress is on a take, America. That's why. Because they don't give a shit about you. Nancy Pelosi, Chuck Schumer, they have their health care. McConnell, that monster, he's got his health care, him and his wife. You don't have your health care. Your Congress isn't working for you. That's basically what it comes down to. But yet they want your vote. They want your vote. The reason why Joe Biden and the DNC are against Medicare for all is because they take big money from big pharma and the health insurance industries. That's why. That's all it's about. It's that simple. Money. Okay? It's not about you. It's about their donors. The DNC, in fact, just voted out Medicare for all, voted it off their platform. Okay? Something like 125 to 36. They don't give a shit about us. They don't give a shit about us. And we're going to vote for them? Why aren't we out in the streets? All right. Hey, you know what this brings to mind? All I can say is, you remember P.T. Barnum? You know, Barnum and Bailey Circus? You probably heard of that, you know, when you're all kids, Barnum and Bailey, right? P.T. Barnum, he was famous for saying, there's a sucker born every day. Now, he had to be talking about in America.